I think vulnerability is the big issue that we need to solve for climate change effects on people with epilepsy. So we know that there are already vulnerable countries to climate change effects, and we know that there are also vulnerable people to climate change effects, not only the people with epilepsy, but also elderly people, for example, children, for example, pregnant people, for example, or people with some chronic diseases such as respiratory, cardiovascular, or neurological disorders are considered more vulnerable to climate change effects than the others. But if we think about epilepsy, the disease is heterogeneous. So disease-based factors also contribute to this vulnerability. So I think the first practical step for the physicians to take care should be to understand, to explore the vulnerability of people to climate change effects. In low-income countries that have limited health care, for example, or limited medical staff, or with a huge treatment gap, climate change effects will be much more important than the other countries. So the physicians, I think, as a first step, should explore the vulnerability of their patients to climate change effects, because, as I said, disease-based factors are also very important. There are also some other vulnerability factors. And then, if their patients they believe that more vulnerable to climate change effects than the other people with epilepsy, then I think the next step is giving some practical tips to their patients in order to protect them, in order to avoid some adverse weather events. And of course, the big solution depends on the governmental solutions. The stakeholders, all these people should take some responsibilities in order to solve all these climate change related adverse consequences for the people with epilepsy, let's say.